Yeah, you read it right. This race will take your breath away. Not wearing helmet or protective head covering is the most common cause of head injuries. So let's jump in and explore more causes of head injury. A head injury is any sort of injury to your brain, skull, or scalp. This can range from a mild bump or bruise to a traumatic brain injury. Major types of head injury include hematoma, hemorrhage, concussion, edema, skull fracture. Not all head injuries are serious. If a patient comes with following symptoms of head injury, it might be consequential. Unconsciousness lasting longer than 5 minutes after the injury. Trouble remembering events immediately before the injury occurred. History of nervous system abnormalities. Bone abnormalities in the skull. Abnormal breathing after the injury. If a patient experiences a head injury and also has severe neck pain, do not move the head because the injury may include neck fracture. On your patient visit, you can ask the patient about stupor, neck pain, motor or sensory changes, discharge from ear or nose, vomiting, seizure, loss of urine or bowel control, tongue biting, pain in other parts of the body, and cuts. You'll want to know if patient has anyone in his family has had any of these conditions like alcoholism, cardiovascular disease, and epilepsy. You will want to know what happened to the patient prior to injury, if he were ever unconscious, and if so, for how long. You will want to know if the patient is taking any of such medications like anticonvulsants, blood pressure medications, heart medications. You may also want to speak with someone who knows the patient to determine if he seemed different from his usual self. You will do a physical examination, including blood pressure, pulse, breathing rate, checking head and neck for discoloration or cuts, touching the head and neck to look for tenderness or bony abnormalities. Thorough ear and eye exams, checking the nose for clear discharge, thorough examination of his reflexes and movement. You will also ask the patient questions to check his mental status, such as whether he knows where he is and what time it is. Now, let us see what can accompany head injury. First, we have drinking problem. Alcohol and traumatic brain injury are closely related. Up to 50% of adults with traumatic brain injury were drinking more alcohol than is recommended before they were injured. People who were over age 60 when they had their traumatic brain injury were less likely to drink too much before their injury, but those who did had worse outcomes. Second we have is loss of consciousness. Concussion is a mild head injury that can cause a brief loss of consciousness and usually does not cause permanent brain injury. Contusion is a bruise to a specific area of the brain caused by an impact to the head, also called coup or contra-coup injuries. Third we have is convulsions. About 10% of people who suffered from head trauma severe enough to be hospitalized end up having a seizure. Fourth we have is blackouts. Concussion may or may not include blackout. The loss of consciousness is often brief and is normally followed by a rapid and complete recovery. So that was all about today. Keep following sqadia.com for more such videos.